Have you heard that your clogged arteries are not reversible? Well, that isn't true. You can reverse heart disease with autophagy, but you must understand the rules or you could make things worse. Before I can teach you how autophagy reverses heart disease, we must understand how heart disease happens in the first place. Heart disease happens inside here, the arteries of your body. And the arteries going to the muscle of your heart are like any other artery filled with a layer of muscle, an endothelial layer, and a very special spot where the fat builds up inside the walls of your artery. And that is heart disease. Most people that tune into the show or join my clinic to do the ketogenic diet arrive with arteries that are filled with disease. Fortunately, it takes years for this pathology to start, get worse, and get to the point where you have a heart attack. So we usually have time to reverse this. To stop heart disease, you must stop hardening the arteries, stop putting pimples inside the arteries, and restore your endothelium. Hardening of the arteries happens right here, in this layer of muscle. And when the blood pressure has been high for not just a couple of weeks, but years, this muscle layer thickens and decreases the size of the tunnel that the blood flows through. To reverse the thickening of that muscle, you must decrease the blood pressure by lowering the blood sugar, which also leads us into step 2, decreasing the amount of pimples found in your arteries. Those pimples are not there because you ate too much cholesterol or high fat. They're there because you had an excessive amount of sugar for too long. In times of high blood pressure and high blood sugar, this excess fat can't end up in your liver recycled. It ends up here in this layer of the artery. And as that fat accumulates, you will find pockets of ripening or a lot of fat. That pimple is the future heart attack. And this cap right over the pimple is important, that it is not thin, but rather a thickened cap formed by decreasing the blood pressure, decreasing the blood sugar, and restoring number 3, your endothelium. Look at these arteries side by side. You'll notice that this one has a very thin cap over that pimple. As the blood sugar and blood pressure decrease, you'll see the inflammation in this pimple decline as well. And that's when that cap can thicken and restore that protective layer that keeps that pimple from erupting into your circulation. The final measurement for heart disease is this layer on the inside of the tunnels of your arteries. This is called your endothelium, and there's a magical protective layer called a glycocalyx that keeps that fat in circulation and not in the walls of your artery. When that endothelium is damaged, your race to heart disease is a lot quicker. And to undo it, we must lower the inflammation, which leads us to autophagy. Autophagy, yeah, we're talking about the recycling of the proteins and the wasted debris in your cells that shouldn't be there in the first place, but definitely accumulates on your path to a heart attack. Autophagy is the reversal of this process, and we can measure that best by looking at a Dr. Boz ratio. The Dr. Boz ratio is based on the glucose ketone index, which has the normal mathematical scale. In America, we use 2 different units, and we use dirty math to get to the Dr. Boz ratio. It really is a simplified version of the GKI. You take the glucose and you divide by the ketones. And this measurement is really the availability of the 2 fuels your body needs to survive. But more importantly, in autophagy, you are lowering that glucose while boosting the ketones. The lower your Dr. Boz ratio, the better your autophagy. When measuring autophagy, I tell patients there's a really high chance of autophagy when that number of a Dr. Boz ratio is less than 40. When they're between 40 and 80, there's a probable chance of autophagy. And when they get that number north of 100, there is a very unlikely chance that their body is recycling those proteins and removing that debris, causing their heart disease. I use this graph to explain what's going on in the patients that come into the ketogenic diet. We have glucose over here on the left side, we have ketones over here on the right, and we are going to watch what their glucose is doing throughout the day. At the beginning of this story, most people do not eat less than 20 total carbohydrates a day, and as a result, their blood sugars are much higher for most of the hours during the day. The lower consumption of carbohydrates drops those peak blood sugars in all 3 meals of the day, and that decreased amount of fuel offers the patient a new fuel. This wave of ketones enters their circulation, and their body feels great during the first season of the ketogenic diet. But that fuel fades as the body adjusts. When they decrease the meals to 2 times per day, once again, ketones return to the scene, and that wave reminds them why they're on the ketogenic diet. As the body adjusts to this new rule, we now must narrow the eating window to keep that metabolic stimulus present, keeping the glucose lowered and those ketones high. Again, trying to reach that Dr. Boz ratio of 40 or less to push that autophagy and reversal of heart disease. The final stimulus to their metabolism based on food timing and choice is to move that eating window as close to sunrise as possible. All of these steps, including the lowered carbohydrates, the decreased eating during the day, and the earlier the meal, stimulate the production of ketones at a more stable and constant rate. As patients practice the habit of eating twice a day, keeping that eating window narrow and earlier in the day, they can see a slump in the ketones again. This is when we start to pull on a different lever of their metabolism. And that's the lever of what happens when their body has to tolerate and offload heat. In other words, a sauna. Spending time in a sauna stimulates the production of energy through their mitochondria. Stimulating the mitochondria happens when you expose the body to heat, and in order to survive, the body must offload the heat. A similar process happens when we exercise. Using sauna and exercise, those mitochondria, well, they get a workout. And it's during that time where the production of ketones is now much more reliable, especially if they keep the rules of those low carbs, tiny eating window, and earlier in the morning. Step number 2 that I recommend for autophagy is a sardine fast. It usually happens at this stage of the metabolic development of the patient where their ketones have sunk again and they're having a difficult time raising them. 3 days of only eating sardines is a fantastic way to decrease the food volume, increase the protein and the fat in a way that lowers blood sugar and raises ketones. In other words, it stimulates autophagy. Take a look at this case study. I took 200 of my students and I followed them closely for 19 days. At the beginning of the study, they arrived with, well, rather broken metabolisms, definitely not in a place of autophagy. As we lowered their carbohydrates, taught them about an eating window, and then moved that eating window to the morning, we saw a dramatic drop in their glucose and a production of ketones. As they stabilized at about day 7, we pushed their metabolism with one food. Yes, we said 72 hours of only sardines was one other way that we could push autophagy. You'll notice right here that the spike in ketones and the drop in glucose happens over those 72 hours. As they reset right after that, we challenged them again at the end of this study to do a water fast. That's salt and water only for up to 72 hours or however long they could handle it. Everyone in the class dropped their glucose over these 19 days, boosted their ketones, and of course, improved their autophagy. I can pack a lot into a video, but if you really want the steps on how to help your heart disease reverse with autophagy, join me for a masterclass twice a year. If it's during that time, click here for that free masterclass, but if it's not during that season, I have all my patients start here with Consistently Keto, the online course that teaches the steps. I'll see you inside.